So, before we get started and I give the speakers' bios, I did just want to mention that neither of our speakers have any disclosures to make. So, that being said, next slide. We'll start by introducing our first speaker, which will be Marianne, followed by Danielle. And we're really excited to have both of them, thrilled to have them speak. Marianne Peterson is the Vice President of Cancer Care at the Colorectal Cancer Alliance, the leading national nonprofit dedicated to ending colorectal cancer in our lifetime. In this role, Marianne is responsible for establishing, implementing, and communicating the vision, purpose, and strategic direction for cancer care within the organization. She guides the development and execution of evidence-based cancer prevention initiatives and patient navigation services, ensuring all programs align with the Alliance's overall strategic goals. And then we'll hear from Danielle Ripley Burgess, who is the Vice President of Disease Awareness at Fight Colorectal Cancer, where she leads national efforts to increase public awareness, strengthen provider outreach, and provide trusted resources for colorectal cancer patients and caregivers. A three-time survivor first diagnosed at 17, Danielle brings nearly 20 years of leadership in nonprofit communications, advocacy, and health-focused storytelling. So we're really excited to have them both. I'll let them take us away with their presentation. So next slide, I believe.
Can you hear me okay? Okay, great. Thank you, Aubrey, and thanks everybody for joining and inviting us to speak today. I am Marianne Pearson, like I said, or Aubrey said, I'm the VP of Cancer Care at the Colorectal Cancer Alliance. A little bit of background on me is kind of a unique story. I'm an oncology social worker by background in training, and I have been supporting patients and families going through cancer for about 20 years as a clinician, as a director of programs, implementing care delivery models for a multidisciplinary team at NCI cancer centers, as well as community centers. A unique thing that happened to me when I moved over to the Colorectal Cancer Alliance 3 years ago, it was time for me to get my screening colonoscopy. And I went after about 6 months of being here, I got my colonoscopy, and I actually was diagnosed with colorectal cancer after working in the field for 20 years and not having any family history risk and coming over to the Alliance. It's kind of like a fate thing or the world universe thing. So I have that experience of being a survivor and diagnosed with colorectal cancer, and then went through that myself. And so I just wanted to share that with you. Aubrey, I didn't miss anything, did I, in my intro?
No, I think you got it. Feel free
Okay.
to roll on in to the
All
rest of
right. So
your.
then we also want to just tell you what we do at the Colorectal Cancer Alliance and how we help the community, how we help the nation and support patients in early detection, prevention, all the way through cancer diagnosis into survivorship. And so if you could, yep, there you go. So we have a variety of support services. We have professional navigators that help walk patients through either screening, early detection, getting colonoscopies, really catching the disease as early as possible. After working 20 years in cancer care, I've never been able to prevent cancer. And now I get to prevent cancer, which I think is probably the biggest thing that is so impactful, is that we are starting early and trying to impact mortality rates and diagnosis rates. And in our mission, our mission is to cure this cancer in our lifetime. We have a new initiative as on the screen. It's called Project Cure CRC, and we are really accelerating the innovation of new drugs to help cure cancer, treat cancer, colorectal cancer. And we have not had any new treatments except for one this year, but prior to that, we've had the same treatments for 50 years. And so Project CRC is going to provide a clinical trial platform research for us to accelerate the testings of drugs to move quickly through the approval process and through the clinical trial process so we could get new treatments to our patients and community. Um, Next slide. These are some of the screening and prevention programs that we do at the Colorectal Cancer Alliance. We provide testing opportunities, financial assistance around colonoscopies. We are doing targeted, focused programs in high disparity areas across the country to focus on increasing screening rates and getting people seen as quickly as possible, reducing barriers to care so that they get screened. We're also working on a national level, like with Fight CRC, to advocate for change in laws and change in prevention measures and coverage and insurance to make sure that everyone gets the screenings that they need to reduce the diagnosis rates. We also have a screening quiz. It's a tool that anyone can take. It's on our website. And what happens is this is a mechanism for people to find out what their possible risk of cancer is or colorectal cancer. And the way that we work patient navigation out with this is if a person takes the screening quiz and their results are they're in a high risk category, they come straight to us and we reach out to patients no matter where you live. International, we have a hard time, but within the states, we reach out to patients through professional navigation, clinical navigation, and walk them through their risks and education and connect them to resources in their state. And if they don't have the resources, it's funding based, but we have financial assistance for patients to get colonoscopies if needed. And we do that through our screening quiz and all these modalities that we have at the Alliance. Next. And then we also have our awareness campaigns, our walks, fundraisers to really make sure that everywhere we are aware, we are campaigning and acknowledging that this is the one preventable cancer. And if you get screened and you know your risks, then we can reduce those rates. And we have walks across the country to do awareness and fundraising. And then the next slide. And then, as always, and you know, in advocacy groups, our biggest supporters are the biggest change makers are our volunteers and our allies. And so we ask that people come join the Alliance and volunteer in their communities and to make sure that we are getting the word out and their patients and families in the community are getting the support they need, hearing it from their peers and people that have been affected by the disease. And so we just really encourage people to volunteer, to get the word out and make, like help us impact to cure this cancer and rid it in our lifetime. Thank you.
I'll jump in. Thanks, Marianne, and love partnering with you. And I was going to kick off and share a little bit of my survivor story. And you guys are getting two very different survivor stories today. I love Marianne's. My jaw hit the floor when I heard that she was diagnosed with colorectal cancer when starting her role at CCA. Mine is very different. And you might have heard in my bio that I became a cancer survivor the day I was diagnosed, which was January 23rd, 01. So think before 9/11, yes, I was only 2 years old. No, I'm just kidding. I'm way older than that. But I was actually a junior in high school. I was 17 and I had had bleeding for quite some time and hid it. Didn't tell my parents, no cancer history in the family. So I didn't even think anything was serious about it. I was kind of caught up in everything 17-year-olds are. But I was rushed to a GI once my primary care physician actually heard my symptoms. And fortunately, in my case, even though it was so long ago, I was sent into a colonoscopy right away, despite my age. And that's when we found a stage 3 cancer. So this was back in the day where I was seen as I always say like an elephant or a unicorn in the oncology ward because at that time, people didn't know that cases were on the rise amongst young people. And actually, I'm at the beginning of that curve when you look at the increase of rates. My diagnosis hit right as that curve started to uptick. So I always kind of wave from the start of the roller coaster, so to say. So they didn't quite know what to do with me. I was not treated as pediatric. I was 17, but they went ahead and treated me through adult care. I went through about 6 weeks. I mean, not 6 weeks, 6 months of pretty intense chemotherapy, surgery, radiation. They just kind of threw everything at me and in desperation. And fortunately for me, my cancer responded. So it did not have any further spots after all of my treatment, and I was able to go back to high school. I graduated on time. I ended up going to college, and you can imagine it hit. If there's any serendipitous time for cancer to hit, I guess it would be when you're about to leave high school, trying to figure out what you want to do with your life. And it definitely helped kind of point my compass toward this kind of stuff. And I actually had a scholarship from ACS. So shout out to ACS. I'm always grateful. I actually had a young cancer survivor scholarship that helped pay for some of my tuition back in the day in college. And it really kind of opened my eyes to advocacy, to groups like ACS at the time. Right around the time I was graduating college, CCA was founded. A couple years after that, Fight CRC was founded. Our founder wanted to focus on advocacy, so she actually helped start CCA and then started Fight CRC. So we're kind of sisters in the fight. So I felt like all this stuff was being paved and formed while I was sorting out what do I want to do with my life as a cancer survivor. And I think that's a big part of that. I know a lot of times if you get to be in a room with survivors, a lot of times what you will hear a lot of us say is that actually one of the hardest parts about this isn't it's going through it is really hard, but when you finish treatment and your oncologist kind of gives you a big wave and says, all right, like good luck, see you in 3 months, and you're used to seeing them every week, it's very jarring. It's one of the hardest points of care as a survivor because you're all of a sudden you're processing emotionally and mentally like what did I just go through? You're you're trying to figure out who am I? Identity comes into play. And so I definitely found myself in that. Fortunately for me, I rushed into college. So some of those questions were answered with my new phase. And I didn't quite have time to really think about that until actually a few years after college. And as I was getting older, as my prefrontal cortex was finally like finished forming, I started asking some of those survivor questions of not only like who am I? I've survived this life-threatening thing, but also like what can I do with this? Or I'm scared of recurrence. So I took to Google one night and I started Googling. I think I started Googling what should I eat as a cancer survivor if I don't, as a colon cancer survivor, like what should I eat if I don't want to get cancer again? Something kind of like that, like addressing fear of recurrence. And up popped this website. And all of a sudden, I looked at a face of a young woman who looked just a few years maybe older than me, and I saw a big long scar down her abdomen, and I my jaw hit the floor because her scar matched mine, and it was part of this group called Colon Club. And I clicked on it and started reading, and I found myself looking at a calendar full of young people like me who also had had colon cancer way too young. And they had also been told they were too young for this and it doesn't really happen. You're one of the only in the country. And all of a sudden I realized, oh my gosh, I'm not the only one. So I delved into this. It was 2007 by this point. So I'm out of college. I'm kind of started my career working at an advertising agency. and I see that they have an opportunity to be part of their next project, which at that time was a calendar. And I quickly applied. I didn't even think about it. I was like, I've got to meet these people. Like, I can't believe this. So, fortunately, fast forward the story, I was selected to be in a project and it was called the Colander. I'm very proud. I was in October of the '09 Colander. But what becoming part of that really did for me was change just really the trajectory of my life and my experience with survivorship. So I entered advocacy and I was able to realize that, okay, I'm not the only one that's gone through this. I'm not the only young person who's had cancer. I'm not the only young person who has a colon cancer. And I'm not the only young survivor. And then, there's 18 million cancer survivors in the world. So I went from feeling so alone and like I'm the only one to now I'm one of millions of people who've survived this disease. And even though my story is unique, I'm still one of hundreds who can relate. So getting involved in advocacy was game changing for me. I entered it through sharing my story. And what that taught me is being able to, I started learning how to advocate for self first, and then I started learning to advocate for others. So when I learned how to advocate for self, I started asking a few more questions. Obviously, I aged out of being a teen with cancer, which meant I suddenly had to take on some of those things my parents had shouldered, like paying for visits and insurance and setting appointments. And so, um, fortunately, I was in an area, I live in Kansas City, and we have a survivorship clinic at my cancer center. I was able to get plugged into that survivorship clinic, and that's where I started learning about things like survivorship care plans and what is that? Oh, okay, this is a plan that tracks what my diagnosis was, what treatments I got, what side effects I might be at risk for. For example, I had radiation. I'm at an increased risk for skin cancer. I didn't really know that until my care plan was put together. And I had kind of a tool to say, hey, like, here's things you're at risk for because you didn't had cancer treatment. So I was able to get one of those kinds of things. I've learned as I've shared that I'm part of this clinic across the country. I've heard this is actually not the norm. So although these care plans and templates do exist and they're recommended, every cancer survivor have one. I'm actually very fortunate and very privileged to actually have this in place because not all centers do that. So that's how I've advocated for self. I've stayed on top of all these screenings and I'm doing really well now. I've had two cancers since that initial one. So I've had a second one at age 25. And then about 2 years ago, I had a third one pop up at 39. And hopefully we're done with this. But if not, I'm in good hands. And part of that's because I've also found the community and I have found a way to use a lot of these experiences I've been through, both here professionally and then just as an advocate. So I want to talk about Fight CRC because the Colon Club was my introduction to all of this. It was this grassroots group and a bunch of us young kids trying to figure out how to raise awareness with our stories. And that connected me to people who knew of advocacy groups like CCA and Fight CRC. And those introductions actually got me into this world, into this role I get to do now, where I get to connect with people and help them know how to advocate for themselves, like what I just talked about. Like, here's resources and information. You're not alone. And then we also show them how to advocate for others. And that's a big part of our mission is like, hey, let's activate, let's turn your pain into purpose and let's see how you can take, your experience and change the world and help others. So if you want to go to the next slide, I wanted to share just a few other resources with you guys. If you have, survivors in your life and you are trying to figure out how to connect them to your plans, your cancer plans, resources for them, I wanted to show just a few things that Fight CRC does, and probably similar to Marianne, it was hard for us to whittle all of the stuff we all do down. So here's just like a few things that we could offer. One thing I want to highlight is we have this magazine called Beyond Blue. This is by survivors for survivors. A lot of us on the team have had cancer in our lives. I should say survivors and caregivers. This is a free magazine that we publish twice a year. It's free to subscribe, and you can subscribe and get a single copy, or you can become a resource champion and we'll send you a box of these every fall and spring. So it's a really helpful way we've heard a lot of times, and I know this for myself, I want stories. I want to see other people who've been through this. I want to see their tips. I want to hear their advice and to see what they're up to. And so Beyond Blue is just a quick, a quick and easy way to kind of stay connected with us all the time. It's print and digital, but even though a lot of things are online, we've found a lot of people like to hold this. And so it's something we do in print as well. If you go to the next slide, I also want to let you guys know about the Colon Club. So that group I talked about that kind of was my launch into this, we merged with them a couple years ago. So Fight CRC and the Colon Club merged. Go figure, the founders of the Colon Club turned 50 and went, we're not like 22-year-old kids anymore. so so we want this to be relevant. We want this to reach the new patients coming in, you know, the AYA community, these young groups, like we want to keep doing what we're doing. So there is this group that we have called the Colon Club designed for the AYAs. So that's you're diagnosed, technically it's 15 to 39. We host colon camp, so you got to be 18 to come. But we host a summer camp every summer. We actually just got home from this a couple of weeks ago. And it's a way for young people to come meet each other. It transformed my life and helped me see the positive of cancer, helped me want to get involved, helped me see how I can help others. So we know a big first step of getting there is just meeting other people. That powerful statement of "me too" can really change your life. So we have this. So if you have any young colorectal cancer survivors in your life, we do a camp, and then we also are going to roll out a calendar. That calendar I mentioned again, we're going to relaunch it this fall. And then we have an Instagram handle, and we have a group in our community of champions where they can find more about it. And the next slide. So some of you guys, if you're familiar with Fight CRC, I'm going to talk the last two slides about a few things you might have heard about. This is really a lot of what we're known for in the colorectal cancer space, and that is our advocacy. So every March, we host Colon Congress, which we bring grassroots advocates to DC. We do training with them on how to share their stories and how to have meetings on the Hill. And then we take them to the Hill the next day, and they really advocate for all kinds of policies. Not going to tell anybody here's something you don't know about how important it is right now to advocate for things like public health funding, research funding, screening coverage. So we weren't sure last year how it would go in our political climate, but we actually had our biggest year yet. We had just about 300 people in DC with us last March. So we're planning to do this again. So welcome all of you on this call to come join us in March. We'd love to have your voices come advocate with us if you're able. If you can't do policy advocacy, we plant flags on the National Mall the day before to raise awareness and kind of get people talking as we go to the Hill. So we'd love to have you guys next March. And then the last slide to show just something we offer as Fight CRC is our Catalyst program. This is something some of you guys also might be interested in, or you're very familiar with it. We have given out grants to 19 states so far. These are program. This is a program that helps fund state level work like what you guys are doing. We're really focused on expanding the access to screening, getting coverage for the colonoscopy follow-up. If you have a non-invasive test, you need a follow-up. We've had a lot of success state level policy. So this is something we also do. And not only does our team at Fight CRC run this out and help provide it, but when it comes to survivors, you know, we help get survivors involved in this too. We've had a lot of wins, for example, in New Jersey, where we had matched a caregiver and a survivor to go testify as part of the Catalyst program in their state, and they saw some really great steps from that. So that's just another area, and I know they're putting links in the column in case you guys are interested. But thanks for having us today. It's been a joy just to share my survivorship story and just encouraging, you know, like Aubrey had mentioned, even Marianne and I were like, okay, wait, we're talking about mortality and survivorship, but hopefully it inspires you. You know, this is the goal. I think we're very privileged to sit here as survivors, and we want to see other survivors plugged into this kind of work because we want to help with mortality. We want to obviously help with prevention and reduce deaths. So our thank you again for having me.
Yeah, thank you both so much for sharing your stories and also sharing the information that you all have because you work for organizations that have just so much information for survivors to learn from and be able to use in a regular way. So a lot of these coalitions, if they're seeing a lot of CRC survivors, which as the second leading cause of cancer death for men and women combined, you're going to see a lot of colorectal cancer survivors. And on top of that, we've seen as well, if you have joined us for some of our previous sessions, how there's an increase in people who are below the screening age that are getting colorectal cancer. So it's really important to be knowledgeable about things that Danielle was talking about her experience, but also Marianne, who was diagnosed truly pretty young, but at the same time, right at that screening age. So that's still quite young, and to think of those specific needs. So I'm not seeing any questions yet, but feel free, anybody who's watching, to add your questions into the chat or the Q&A box at the bottom. But we do have a couple questions that I know will kick us off on some of these things. And so I guess because we're kind of talking mostly about your experiences as well, I would love to ask, how are the needs of colorectal cancer survivors different than some of the other common cancers like breast or lung? And is there anything that people should be aware of when working with CRC survivors specifically? And either one of you can jump in.
Um, I mean, I guess from my experience in caring for patients as a clinician and their families, there's a couple things, and I'm sure Danielle can list all the things that have affected her, but things like body image, intimacy and sexuality, pain, just side effect treatment side effects, the survivorship, situational anxiety, depression. We don't talk a lot about the mental health side of being diagnosed with cancer. And I think that's one thing that with younger people, especially because they're hit at a time of their life that this wasn't supposed to happen to them. And that's also another topic that is impactful.
Yeah, I agree with everything she said. I think there's parallels in any cancer diagnosis where you have to fear mortality and wrestle with that. But there's something about there's something about dealing with things with your gut. And I think everyone on this call can really, probably haven't had colorectal cancer to know, like when you have tummy troubles, you have
Yeah.
diarrhea, when you have constipation, like you're just, everything about you is off. And so the gut being such a center of health, I think when you have colorectal cancer in that area of your body and your treatments and your surgeries affect it on top of just the everyday things you're eating and you're drinking, like there's so much fear that comes with any cancer, but especially colorectal cancer is just different. And I think it's more sometimes not more emotional, it's just emotional in different ways. I mean, there's the realities too, like ostomy life, and even if you don't have an ostomy, you might have urgency issues and incontinence. And so I think that's what I would say is just there's so many bathroom issues, like, and you think you'd know that, but what we live with is post treatment, the bathroom issues alone can really zap your energy and bring you down. But at the same time, I think some of the most passionate advocates probably come out of this community because our guts have been sick and we know what that feels like. And we're desperate to save somebody from going through this experience.
And I
Yeah.
think also something else that affects colon cancer survivors differently is food and nutrition. And every other cancer, they're like, you need to eat these vegetables, you need to eat this healthy food, you have to have organics. But because your gut and your bowels are affected, you have a totally different way of needing to eat depending on your disease and your treatment. And then the survivorship phase is you can't eat broccoli, you can't have lettuce, you have to have tons of protein. And if you have an ostomy, there's the stigma of noises and smells and a bag, and you want to go on the beach, and you don't look like the other people on the beach. And so there's those things too that I think there's a perception of cancer survivorship that CRC patients have a totally different path
Yeah.
than
Yeah.
other cancers.
Yeah, I think there's some unique challenges for sure, and I appreciate you all, speaking to those because yeah, it's a very common cancer. It's increasing in people who are younger, and to really think about some of those unique challenges and even connections to things you're doing about healthy eating and healthy living as well.
Yeah, the stigma around poop and stool, that's half the problem, right? In our country, we don't talk about it. So that's why people don't go to the doctor. They don't get colonoscopies because you can't talk about your poop with anybody, right? Or you're like Danielle was saying, is if you have incontinence, if you have, it's just a lot. It's a lot. And we try to destigmatize this disease, is really what my goal is. And I there's a reason why I say colorectal cancer too. So we destigmatize the word rectal. We could say colon, but not rectal. So those are
Yeah.
little things we could do to change.
Yeah, absolutely. We did have a couple other questions. I'm glad that everybody's on the call to talk about this, but we did have a couple other questions as well. So someone mentioned a lot of us can't advocate as we're funded through federal grants or advocate in the traditional sense. And so what do you recommend as a tangible action step that they could take to support survivors and reduce mortality?
Yeah, I think that's a great question, and this is common. So, so honestly, we've had people join us in DC just for the learning and the training, and they don't go to the Hill because understood you can't advocate. That's okay. So I think that's part of also why we've included our event in March called United in Blue. So it's a companion event, but it's focused on awareness. And so we plant blue flags in the National Mall and put up signs with education. So that's something to participate in, not engaging in any kind of, rule breaking advocacy. And then federal grants can make it tricky, but usually just everyday survivors can come. So spreading the word, letting people know what those activities are, what's available to them. I don't know, Marianne probably
Yeah.
hears this too, but people hear all the time. I hear all the time they just wish they would have found us sooner, and they wish they would have known groups like us exist. And a lot of times people find us in survivorship, after they're through way far through their journey. And so knowing groups like this, like letting people know sooner that we exist, we have resources to help them, and we have ways for them to get involved would be would be so helpful.
Yeah.
Great.
Anything to add to that, Marianne?
She did a great job.
Okay, perfect.
That was a great answer.
I think we have time for maybe one or two last questions. We'll see how this one goes, but I know you all mentioned this as part of your presentations as well. And while we were talking before coming on the meeting, but a lot of the people on the call are public health professionals or work at state health departments or in coalitions. And so can you give examples, and I know you can, of how you've been involved in like that public health work or involved in coalitions specifically? On this specific work as survivors.
Do you want to go first, Danielle? I was like trying to think of the different ways I do.
Yeah.
Sure. Well, yeah, so I'm one of a team, I'm one of a staff of 35, and then we have thousands of advocates across the country kind of engaged in the public health work and coalitions. So the Catalyst program that I mentioned is a big coalition builder where we've got grants going to states, and that's kind of putting together that work group, and we're involving that survivor voice in there. Laura, I saw your question, and I'm going to answer. I'm going to put a link to our victories page where you can kind of go through and read some of the specific victories. Like Kentucky helped get something, the pharmacies to cover at-home screening, and like New York got something about I think the age at 45. So it's different per state, but that's a lot of what we do is we go into the states and individualize what needs to be done here, and based on the state leaders, they get to drive the priorities, and we help facilitate those meetings. So that's a big piece of our work. We're involved in all kinds of things. We have research advocates speaking into clinical trials and clinical trial design. I personally have, shared my story with Iowa. I don't know if anybody's from Iowa here, but I go in and speak and share my story to coalitions like you guys, and then we can help line up speakers if you want to survivorship meetings and things like that. So every state's different. You guys know this, but we kind of try and meet you where you're at and engage you and bring every resource that we have.
Yeah. We do similar. Me personally, because I live in Colorado, I'm on the Colorado Cancer Coalition in my state, but we also do advisory. We sit on advisory boards and committees and in any state that we're asked. We also do patient insights and give feedback on like what Danielle was saying, clinical trial, any kind of biomarker testing. We try to influence the industry as well, our industry partners who are creating new treatments and yeah, just all different ways.
Yeah. Yeah, I think it's so important to have, the survivor voice and a lot of the different things that you're doing as a coalition or the work you're doing as a state health department to really understand how they have specific needs and they can really advise you on what is best going forward for some of your plans as well. And so I really appreciate you both sharing your stories, sharing the resources that you have at your individual organizations and how those all connect. We are running up against our breakout session, so we're going to send people into those breakouts shortly. I know we have a few questions for you all to discuss. Basically, they'll be covering a little bit, touching on the things that we talked about today. You can read them here in the slide and